Hi, Michelle.
Hey, how are you?
It's good to see you.
So great.
Sorry, I picked a freezing cold day.
No, listen, it's a part of where we are.
Yes.
Yes.
I know.
Look at this. This is Stevie in the background.
Music
I
hall.
love that.
Yes.
Yes.
I'm so excited for our conversation.
Yeah,
Let's
me
go
too.
in.
Yeah, absolutely. Music hall, Detroit.
Yes.
Best time of the year, right on the cusp of the holidays. Love it.
Yes. What's your favorite memory?
So I'm going to tell you that I am so excited that the Nutcracker is here. I've seen it a million times, a million different places, but it's going to be so special here at the Music Hall.
Let's go in.
All right.
Michelle Johnson-Dajani, thank you so
Hello.
much for being here.
Oh, I'm delighted.
You're our Executive Vice President, General Counsel.
That's right.
For Henry Ford Health.
Yep.
It's kind of a broad question, but tell us how you got here.
Oh, that's
How'd you
fine.
end up in this position that you're in this place and time?
I went to law school not that long ago and decided I wanted to make a difference in the world. And I'd say I fell into healthcare. I started practicing representing physicians in hospitals, and I started as a litigator. I love advocacy, and I love representing the interest of people that I believe in who want to do the right thing. So that's what I started doing. I litigated for about 4 years in private practice, but there's something about the opportunity to get ahead of issues which appealed to me. Really, my space and place has been around growing organizations. Core to that has been understanding the business of those companies and helping those organizations try to drive that. And so I went back to the Cleveland Clinic for about 6 years and had a wonderful time until one day there was this opportunity to come back to the city of Detroit, which I never expected. I mean, this is home for me. I am a Detroiter through and through, grew up on the east side of the city. But there was an opportunity that someone shared with me to be the general counsel at Henry Ford, and I thought, really? Could this be? And so at the Cleveland Clinic, I had a number 2 position. I wanted to have the number 1 position, and this was that opportunity to do that. So had an opportunity to come out here, had a great conversation, lots of different conversations, but that final conversation was with Wright Lassiter, and I thought, this is it. This is absolutely where I want to be. This organization is the kind of place I want to practice. The people that I met along the way were the kind of people that I wanted to do business with. And so the move from Cleveland to Detroit was easy.
Oh, well, we're so glad you're here.
Oh, what a great venue.
Yeah, I'm excited to it's so rare that you get to be here with nobody here.
I know.
You're
I know.
very-
It feels like sort of a very special
they're very
experience.
gracious to let us come. Here we are.
Yeah, this is incredible.
Yeah.
If you weren't standing right here, I would indeed run right up on stage, because that's just what I would do.
Michelle Johnson-Dajani live at Music Hall.
Right now, mics and all.
I feel like it's
incredible.
for you there. Yeah. Oh,
It is.
And honestly, when you think of Detroit and its beautiful Art Deco, I mean,
my God.
just
This is quintessential Detroit.
Yes, it is.
Look at the architecture. If you stand back and do nothing else, there's nothing on stage, there's no one here. Look at the architectural beauty that this is.
wow.
Wow, this speaks volumes.
I know.
It's beautiful.
Your career, started in one place, but really has been the bulk in healthcare, right?
It always.
Are there any lessons that you've learned along the way that really stick out to you?
People come to healthcare lots of different ways, but healthcare outcomes, the experiences that people have with healthcare, a bit of that is what happens in the inpatient setting, but so much of how people navigate healthcare happens outside of the healthcare system. And so one of the things that's super important for me is to understand the entirety of that experience. Understand that if you don't have a job, then you don't have healthcare insurance, and so your interaction with the healthcare system is going to be different. If you don't have a place to live, then the notion that you should follow up with your appointments or fill your prescription, your perspective on that is going to be different. I don't know, I just feel strongly about the complexity of healthcare, because oftentimes people will describe patients as non-compliant. Well, I didn't have breakfast and I didn't have a way to get here. So am I non-compliant? Sure, I haven't done the things that you said, but you're not appreciating the whole story. I think healthcare in some respects is just a microcosm of just the human experience, right? You meet people at a particular place and time, but the entirety of that person is so much more than how you experience them in 30 minutes, right? It's how I woke up. It's whether I had heat that night. It's whether I had a meal in the morning. It's just, it's whether my parents were there. It's all of those things. That's what healthcare has been for me.
Detroit, we're so lucky, like you mentioned, to have Music Hall, Opera House, Fisher Theater. I mean, you
all at your
name
fingertips.
It. Yes.
And it's still very affordable theater in the city. It's accessible and it's affordable.
Do you ever think about Henry Ford Health also being kind of part of that
Oh,
tapestry?
absolutely. At a time when so many people abandoned the city, Henry Ford made a commitment to stay and continue to serve. I mean, that's another, that's another proud moment. I love that we are still here. Doing what I would just characterize as God's work, right? Caring for people, caring for patients, caring for members. I mean, this is home for us.
Yeah.
I say that about our downtown location. I mean, we obviously have lots and lots of locations across the community, but particularly in the city of Detroit, this is home.
Yeah.
It's where we belong. So it's nice to be here.
It's a privilege to be part of that story.
It is. Yeah. It is. It absolutely is.
Yeah, beautiful. From your perspective, where do you see the future of healthcare going?
Well, I think healthcare is filled with opportunity. The industry is moving from inpatient to outpatient, so how are we going to be there for our patients? We're moving into a digital world where people are accessing healthcare differently. How are we going to meet the needs of our patient using our digital footprint and connecting with them a little bit differently? How do we make it easier for patients to interface with our system? Thinking about ways to make it as affordable as possible for those who are insured. And what about those who are underinsured or don't have access to care? I see the future of healthcare as meeting people where they are. And I think there's both it's the right thing to do, but there's also a business imperative around doing that. It's costly. Healthcare inequity is a costly proposition. Having people access us through EDs, it's costly for consumers. And guess what? It's not the best healthcare. So figuring out this sort of conundrum of meeting people where they are with low cost or appropriately priced resources and giving them the kind of interfaces that create ease in terms of accessing healthcare, I think is the way of the future.
What are you most proud of at Henry Ford Health?
The people. Yeah. One of the things that I love about Henry Ford is how much people love Henry Ford Health. I used to say, you interview people as you hire people, as people come throughout the organization. I used to say it's the culture, but that's kind of a cop out. Really what it is, it's the people. It's how much people are committed to this organization. When I first started, I had 3 people on my team who'd been with this organization 40 years or more.
Wow.
So what that does is it creates, I think, opportunities for storytelling. I always ask them, so why do you stay?
Yeah.
And the reason they stay is because they love what we are and love what we have meant to them. Most people have a personal connection to the organization. And I think when you have people who are as committed as so many of our employees are, you have a more powerful opportunity to make a difference. Because when people believe in the story of our organization, I think it allows people to support the direction of the organization in a very different way. And so what I love about this place is really the people.
Love that answer. This is a Women in Leadership series.
Yep.
So I would be remiss if I didn't ask what you would tell a young woman in our organization or a woman who's rounding out her career in our organization.
Yeah.
Just anything about your journey that you've learned that you would love to impart on young mentees. What would you say?
Well, that's a good question. So here's something that I feel really strongly about. If you're a young woman and you elect a partner, that's a choice, right? So if you elect a partner and bring somebody along your life journey, the most important career decision you will make is who that is. And I think that's true because I think as you navigate throughout your career, you have children, you decide to move from place to place or even grow in an organization, careers are not always a straight path. And so one of the things that's super, super important is a support system. And that partnership ought to be your go-to in terms of support. And so how will you partner? How will you be supported? How will you navigate who's dropping off who? I oftentimes tell young women, allow your partner to really be a partner. Let's not judge. The hair doesn't look like what you might have done. The outfit might not coordinate the way that you might have done it, but support that. That partnership has just been everything. It's been everything for me. Yeah. I'm really grateful to my husband and what he's meant for me in terms of just a backbone, a reality check, a mirror along the way. So that would be my career advice. Be thoughtful about that partnership decision.
Michelle Johnson-Dajani, our Executive Vice President and General Counsel, thank you so much for sharing your time with me.
No, thanks for the opportunity. This has really been a treat.
Thank you so much.
I know. This is my confident walk.
I don't have a confident walk. I'm just gonna trip every time I walk.
My feet are hurting. My feet are hurting.
Dun, 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 dun.
Yeah.
I'm the investigator. You're the prosecutor.
So confident. Oh my gosh.